Hello, I'm Tu Kim Lam. Welcome to the Medical News Show. In this edition, we will talk about sleep apnea. Sleep apnea currently is a problem for millions of Americans, and every year we have over 100,000 of traffic accidents caused by the patient with sleep apnea. Here with us today is Dr. Tran, who is currently practicing internal medicine in Falls Church, Virginia. He will give us the latest findings result of the sleep apnea based on May 2012 report. Welcome, Dr. Tran, to our Medical News Show.
Hello, and welcome to our show today. And again, hello, Mrs. Lam.
Dr. Tran, today we're going to talk about the sleep apnea. First of all, would you explain to the audience what is sleep apnea means?
The sleep apnea, if you see the term, is sleep and apnea. Apnea means the abnormal pause of the respiration or breathing. During sleep, if the patient has regular sleep pattern, then really it's not related to the sleep apnea. But sometimes people stop breathing, we call pause. So that's the disease related to sleep apnea we want to talk about today.
Dr. Tran, there are different forms of sleep apnea. Would you please explain about these forms?
Remember, the sleep controlled completely by the central nervous system, including the respiration. The respiration including all the nose, the back of the throat, the tongue, and the trachea, and the lung. The whole system we call respiration's muscle system, or the airways, or the upper airways. The upper airway is also controlled by the brain, meaning the central nervous system. Therefore, we have three forms of the sleep apnea. The first one is the abnormal disturbance or of the central nervous system, means central cause of the sleep apnea. Very rare, only about 0.4% of the cases. The most common form we call obstructive sleep apnea. Obstructive means obstructions of the airways. This is the most commonly form of the sleep apnea, usually about 84% of the cases. And the rest of the cases, the mixed one, the combination between the central cause and the lower cause of the respiration. So this is the overall pictures of the sleep apnea. But today we just focus on one sleep apnea causing by the obstruction. We call it obstructive sleep apnea.
Dr. Tran, would you please talk about the mechanism of sleep apnea?
Yeah, very important because that's after so many years studies, and now most of the experts and the scientists know exactly what causing the sleep apnea. If you look at the pictures on the screen, on the left side you can see the regular airways. The nose is open, the back of the throat is open, the tongue is not dropping down on the left side. On the right side, you can see the airways, the upper airways were obstructed. When people sleep, mean the tongue, the base of the tongue drop back, and the palate, mean the wall, the upper wall of the mouth also drop down because during sleep, all the muscle relax. What happens is when it relax, everything is dropped down and causing obstructions of the airway. Now, if you look at the movie, you can see clearer how it happened and how the brain responds. First, you see the pictures, the breathing go through, but suddenly you go through the obstructions. The base of the tongue drop down, and then causing complete obstructions. Therefore, patients stop breathing at that point in time, or they have to try to overcome by breathing harder and harder and making more sound. And the brain see that happen. It will signal for the patient to be a little more awake so they can try to overcome that and resting that causing the pause of the breathing. So the cycle is go like this, the breathing slowly and go up higher, and then suddenly they stop. They stop for about 10 seconds to 1 minute. And they keep doing that in cycle during sleep. We call it sleep apnea. So this is basically the underlying mechanism that right now we know very clearly and know exactly what causing of these.
So Dr. Tran, what are the risk factors that cause obstructive sleep apnea?
The risk factors is really multiple. because we have different things and relate to the risk factors. The first one is very important, obesity. And some people was born would be very thick and short neck and small airways inside the mouth. And people usually drinking a lot also have the risk of having that. People with long-term hypertension also have some risk factor involved. And lastly is this, people try to using different medication, or they overuse the sleep medication combined with the alcohol, also run the risk of having sleep apnea.
How did you make a diagnosis of the sleep apnea patient?
Before we're talking about the making diagnosis, I think is we have to really base on the symptom that most the physician will receive, but not from the patient. Sometimes the patient just like a complaint of sleepiness, daytime drowsiness, or have trouble driving because it's oversleep, and they may cause some accident, or they may not have doing well in at work. So snoring is important because most people, when they snore during sleep, they cannot recognize that. And they have to rely on the family member, the spouse, to recognize that. But most of the spouse, they think snoring is normal. But most people, they snore all the time. So therefore, we need to know exactly what's the normal snoring and the abnormal snoring. Normal snoring, even though it's so loud, it doesn't mean it's have a problem. That means they have the airways narrow and small and causing a loud snoring. But the abnormal snoring means when they snore, they sound different and they get increasing with time, and suddenly they stop breathing for about 10 seconds to 1 minute. When we see that, we have to really let the patient know and let the physician know that's a problem during sleep. So we'll try to make the diagnosis of that problem.
Dr. Tran, so in case a person cannot recognize they have the sleep apnea problem, what are the complications that lead into the health issue if they left it untreated for a long period of time?
We have to make the diagnosis because we not really go to the diagnosis yet. So I think we have to go back to how to make the diagnosis correctly, because we based on the symptom, but now we have to make diagnosis. Diagnosis is to make the clear diagnosis, we have to use the oximeter. Oximeter is a small device with the tip of the device hooked up on the fingertip to measure the oxygen in the blood. During sleep, if the oxygen saturation drops down below 90, especially around about 70 or 80 oxygen saturation in the blood, very likely the patient may have the sleep apnea. Then, if that happens, the patient will be referred to do the sleep study. Sleep study will be done at the special place called sleep lab. The patient required to sleep there overnight. At the same time, most of the experts will hook up with different systems to monitor the activity of the brain, monitor the activity of the lung, and then monitor the oxygen saturations and measure how many times that they sleep, they have the pause or they stop breathing. Now, if during sleep they have really about 5 to 15 events, then we call very mild obstructive sleep apnea. But if they have moderate disease, like 15 to 30 times that stop breathing, we call moderate degree of obstructive. Now, if it's over 30 per hour, I mean during 1 hour, a person stop breathing for over 30 times, that's quite severe cases.
What are the complications if the patient has been left untreated?
The complication is multiple because it's very important. People may run into complication, they're not aware of that. Number one is uncontrolled blood pressure. Sometimes the physician have a hard time to treat this blood pressure because if they cannot recognize that the patient has sleep apnea. Number two is the patient has irregular heartbeats called cardiac arrhythmia. Thirdly, the patient have the daytime sleepiness, drowsiness, become irritated, angry easily. Especially if they have to undergo surgery, they develop more complication as well during surgery. And lastly, the oxygen saturation may affect the eyes. People may develop increased pressures in the eye called glaucoma, and also increased edema of the back of the eye called retina, called papillema of the retina. So these are very serious complications just causing by sleep apnea.
What are the treatments that are available for the obstructive sleep apnea nowadays, sir?
The treatment, we have really three different types. The first one is lifetime changing. Secondly, they have to use some device to help the patient to breathe. And lastly, we have surgery. So these are the three. The first one is lifetime. Lifetime means the patient have to be losing some weight. If they overweight, they have to really stop drinking alcohol if they drink a lot. And they have to use some nasal decongestant to make sure the airways are open, especially the nose. And try to learn to sleep not on the back, but on the side, in order to prevent the base of the tongue drop down and causing obstruction of the airway. So this is the first step of treatment.
So besides life-changing, what are other treatments that can use?
The second type of treatment they call the therapy, and the most commonly used right now is called CPAP. CPAP stands for continuous positive airway pressure. They call it CPAP. What it does is really the patient have to wear a mask with very tight mask to cover the nose and the mouth. If you can see on the picture. And then the machine will push some air inside that system to the tube and with some pressure to open up the obstruction during sleep. So you can see how effective. Usually we measure how much pressure we have to use on that, either 8 centimeters of water's pressure or up to 12, when depend on how much obstruction inside the airway. The pressure will be increasing. They have patient to overcome the obstruction during sleep. Most people, they do well with the CPAP, but some people, they cannot tolerate the machine. They cannot tolerate the mask put on their face, and they don't like it because they cannot travel. They can have to sleep most of the time at home. So really very effective, but sometimes people, they don't want to take that. To replace that, people right now very commonly use in Canada and Europe. The dentists will use the special dental device and to push the jaw up a little bit and prevent the tongue to drop down. So this is very commonly used nowadays as well.
So besides the therapy and the mask, what any surgery can be done?
The surgery is really well done for a long time. It's been going on for 20 years and use different kinds of surgery. The most commonly used are called UPPP, the uvulo-palato-pharyngoplasty. If you look at the pictures on the left side, the whole back of the throat, including uvula, the pharynx, and also when they want to open up, they have to cut the uvula. They open up the back of the pharynx and they remove all the polyp. They correct the nasal septum. And if they have the tonsil, they have to remove to open up the airway in the back of the throat so they can prevent the obstruction during sleep. Now, the second surgery is more effective, but it's more aggressive. They call the maxillomandibular advancement. Maxillomandibular means they do surgery to move the mandible upward or forward a little bit. So during sleep, the jaw cannot drop down and causing obstruction. This is a very effective surgery. The cure rate may be over 90%, but really very aggressive, therefore really not popular yet, but very effective. And lastly, if these treatment is fail, the only way they have to open up the airways by open up the airway and the trachea, in the front of the neck, we call tracheostomy. So this is all the treatment currently using in the United States and around the world to treat this very special disease called sleep apnea.
Dr. Tran, I understand last May there was a report on the study on sleep apnea from the University of Harvard, Department of Medicine. Would you please give the report on this research, sir?
This is the reason why we provide information today, because I understand that you already hear a lot about sleep apnea on the news, on the magazine, on talk shows, almost everywhere. But this is a study really newest for this year in May 2012. A group of experts in Harvard Medical School in Boston, they study on 15 to 21 person aged from 30 to 60 years old, and they have the disease called sleep apnea. They study all kind of treatment modalities on this group, including exercise. We're talking a lot about losing weight, we're talking about alcohol, talking about sleep on the side, but really exercise is the key of this study, because they found that people really have correct exercise will reduce the incidence of the sleep apnea and improve the daily life function. The studies make the conclusion because they thought it could be exercise just to reduce the weight, but on top of that, the patient exercise feeling much better, and the strength of the upper airways is improving, so they can breathe better, they can overcome the obstructions of the airways, and also they always feel good because they exercise, and they function better at work or any situation they have to work. So this is so very exciting, even though nothing really exciting in terms of medication or treatment, but really simple procedures like exercise can reduce a lot of things for people really having this very bad disease.
Sir, before we close the show, would you give the audience some advice on the sleep apnea?
Well, really, basically, it's so simple advice. You have to do losing weight. It's sometimes easy to talk, but it's difficult to do. And number two is exercise correctly. Means you have to do exercise at least half an hour to 1 hour a day, and to increase the heart rate up to 100 to 120. Either walk fast or run a little bit or jogging, and then sweating a little bit. That's a real exercise for about half an hour to really 1 hour. And then avoid alcohol or any sleeping pill, because that's maybe causing problem. Sleep on the side instead of sleep on the back, and then keep all the nasal passages open by using nasal spray or anything that keep the airways is good. I think it is with that recommendation, I think most likely we can able to reduce the number of sleep apnea on the cases.
Thank you, Dr. Tran. That is all the time we have for Medical News Show today. Thank you for joining us, sir.
Thank you for watching our show today. Remember, we're talking about some new study today. It's May 2012, but the medicine always progress and only new things come up, and hopefully in the future we have different treatment that really provide better way to treat the sleep apnea, especially obstructive sleep apnea in the future.
Thank you, Dr. Tran. That was Dr. Sang Tran, who just shared with us the information regarding to the sleep apnea and the latest findings. We hope that the information provided by Dr. Sang Tran has shed more light on the sleep apnea, hoping that it can help you to prevent the health issue. That is all the time we have for our Medical News Show today. Thanks for watching. I am Tu Kim Lam. We'll see you next time on the Medical News. Until then, have a good